So the theme of today was honoring the past, celebrating the present, and informing the future. And so we thought a really good way for closing comments, to comment on the day's events, to lead the final discussion, would be to have the past and future represented simultaneously. So with that as an introduction, may we have the Janowskys.
It's been really neat hearing where this department came from and the substantial growth that's happened over the last 50 years. As a fourth-year resident in family medicine and psychiatry, I've really gotten to practice in a lot of different settings. A lot of them have been discussed today, from outpatient psychiatric services to St. Vincent de Paul to child and adolescent psych unit to eating disorders. It's been a real lot of good learning and getting to work with a real diverse patient population, from low socioeconomic status to people who really have a lot of means. So that's been a great experience, and I've had a lot of fun while I'm doing it, for the most part, on most days. But I do see the frustration in myself and my co-residents and attendings and our interdisciplinary colleagues in response to the constricting healthcare system. The documentation, the insurance reimbursement, the prior auths, the ICD codes. I hear you, Dr. Barbara Perry, because the administrative burden is real. And I'm sort of surprised at how complicit we've all sort of become with this real burdensome healthcare system. And the message that I tend to hear is that this is the way it is, this is the way it's gonna be, go do some yoga, get some lavender essential oils, and, adapt. My hope for the future of academia and this department in particular would be to, really focus on a different kind of research, one that challenges some of the barriers that we really take as just status quo, and change the system, improve outcomes, and decrease moral injury of the providers that are a part of it.
Okay, that's my girl. Okay, well, I was going to make my comments too. Sid talked about the past and the future, and so I'm going to talk a little bit about the past to start with, because I like the past. It was good. I came here almost by accident. We were in Nashville at Vanderbilt, and Arnold Mandell somehow came by, and I can't quite remember how that happened. And we had a great house looking at a great view in the middle of Middle Tennessee, and he sat in our living room, and he was the most seductive, best recruiter I've ever known. And so I was all excited, and then he said, well, we don't really have a place for you. This was months later, of course. A year later, I was ready to get out of North Carolina, and I was offered a job at Sepulveda VA as part of UCLA, as running a ward, I suppose. I can't even remember what it was. And I went out there to sort of look for a house, and of course I had my family back in Tennessee, and I looked over into the valley, and it was like this layer of brown goop. And I thought, oh my God, and I knew how my wife really had loved LA the first time around when we were there, and so I thought, this isn't going to work, and went back to to Tennessee, and said, well, okay, you don't want to live in the smog, do you? And she said, no. And so I said, sorry about that job. And about a week later, Lou Judd called me up, and he said, well, we have a position for you if you'd like to go there. And I said, okay. And then I came. And someplace in there, we talked about salary, which he said, it'll be low. And he talked about resources. He said, there may be none. And I said, that sounds really good to me. And so, but he did say, it may be possible that you can work on 80 East and make a little extra money, and maybe we can get you a secretary and stuff. And he came through with everything that he said he might do. And I came here because I wanted to get out of Tennessee. So anyway, that was speaking, I think, only to the generosity and trustworthiness of how this system, and especially Lou was, and Arnold too. So I arrived in 73, which is after the department was 4 years old. The VA had just opened recently, and I think my first job was to be on the liaison consultation service. And the thing I want to really talk about, which is part of what Mari talked about and Barbara did and a lot of people did, is that, well, in the positive sense, is this was an extremely creative, innovative department. Arnold was running it. Arnold if you don't know him, is a very creative, innovative, test the limits kind of guy. And that's exactly how many parts of this department was. It definitely wasn't buttoned down. And so anyway, I then went on to be the ward chief of 8 East, which was the, what is it, NMBU, whatever.
NBMU.
NBMU. I mean, it gets tough to remember this stuff. And thanks, Mari.
Yes.
And so I'd been trained to be in a therapeutic community environment. And for those of you who don't know what that is, that was a system that was set up primarily to take care of addicts and so on, but it later kind of metastasized into being for psych patients in general. And this ward that I was on as a resident went into these principles, which I'm going to talk about in a minute. And so, and in fact, I had been, to escape the draft, I had gone to NIMH as a public health officer and a researcher there. And I was going to run a therapeutic community, an egalitarian system that are set up, everybody's the same, everybody calls each other by their first name, nobody wears white coats, etc. But they fired the guy who was going to be my boss, and that ward was going to be compared with the pyramidal normal ward. And so suddenly I went to a psychobiologic unit with William Bunny, and totally out of my area. And then I was a psychobiologist and a psychopharmacologist, which I kept doing. Anyway, I set up I was then now going to be running this unit down at 8 East, and I set it up as an open system. The patients and staff, but especially the patients, got to vote on whether the door was locked or not. They voted on each other's passes. It was very egalitarian, and the residents came down there, and some of the residents absolutely hated it, that they called by their first name, and they thought they were a doctor, et cetera. And I say all this because this was a very fluid, creative environment at the time, and that was the only program that was sort of like that, and I think some of the others would have been at least touched on. To give you one other vignette before I go on about this, then it got to be 1978, and Lou and Arnold approached me and asked if I would be the PI of an NIMH Mental Health Clinical Research Center for Affective Disorders. So they were just having these come out. I guess they've come and gone since. And so anyway, a site visit happened after a while. And this was a collaborative thing. A bunch of the faculty put together the basic and the clinical, and we're all going to work together and da-da-da-da. And so the site visit came, and there was a friend or two of mine, including Fred Goodwin, who came on the site visit. And after the site visit, we decided to invite them over to my house, which had a swimming pool in the La Jolla Shores area, and have them, and we all sort of sat around and had a party. And there was some pot being passed around to various people, and this was the site visit visiting us. Now, and they gave us a good score. I mean, it was a good thing, but I'm just trying to set the stage for what it was like. I mean, okay, maybe So anyway, we had a great time.
No wonder we're burnt out now.
It all happens, So anyway, I should mention, by the way, that ward, because it was really an extraordinary ward, and I'll just tell one other quick vignette. Hamp Atkinson was my chief resident at one point, and I think actually right away. Well, Hamp is a pretty straight arrow kind of guy. He wears a tie, buttoned down and stuff. And then there was me. And I was more woolly and stuff than I am now, had longer hair. I had hair, that was the good news. And so so one day, somebody was coming to look for a job. And we had a sort of an office that we shared, and I was sitting in my office area, he was in his. So this person looking for a job goes walking up to Hamp and starts talking to him, hello, I'm Joe Blow, I'm looking for a job with you. And Hamp says, he's over there. And I was basically dressed like I am now, except sloppier. And so anyway, I was the ward chief, meaning moving along. Okay, so Barbara and Maury brought up the tyranny in my mind of the bureaucracy. And I've watched it increase and increase and increase in medicine in general, in psychiatry. I've read recently that something like 40 or 50% of psychiatrists' time is spent doing bureaucratic paperwork things, computer stuff that does not involve a patient. If I could go to, say, Igor and say, I want a job, I want to get paid whatever I'd get paid. But I want 40% of my time to go to the beach or lay around or watch, Trump do his latest deal on TV. I don't think he'd offer me that job, if I said, but I really want it. Well, that's what the paperwork's doing. And I would challenge our department to have a study, and it's a double-blind crossover study of some sort or other where somebody has absolutely no paperwork. You can write, like I used to at 8 East, patient seen, doing well, status quo, Haldol increased. That was my note. None of this 5 things to prove that I was, actually working, because that whole system is set up to distrust the doctor, to not give the doctor or the psychologist doctor or the therapist. They don't. It's not. You don't trust them. They might just screw you. Somebody might even take your, get a little extra money out of the deal. And so, so therefore we've made a horrible system, which is so incredibly toxic, and makes people quote burn out. So then, like Maury said, you can go do yoga, you put lotions on yourself, you have extramarital sex, you do whatever you're going to do. But, it's like, okay, they're just making the slave more resilient. And so my personal feeling is that academia should be some form of a, if they, on Tuesday there's going to be a strike here. Well, I don't know if everybody should strike, but I certainly think we should be a bloc that asks for legislation that basically says, control this thing, because it's nuts. Okay, so that was my soapbox. What about the future? Well, I think the future, I have a dream. And my dream is that we go back to the past, because it was a lot of fun. And the second dream is that all these things we heard in the last 2 days before today, the science, if that got applied and studied and in fact worked, and all those little things that are so esoteric were actually working, in 50 years, that's what it said, it would be a better world almost, and certainly. And the other thing I think about 50 years is that we live sort of on a cliff, and then it cascades in a canyon down to La Jolla Shores. And I think by then we might be oceanfront. Okay, thank you.
Okay, and we have a special treat, that a little song, and you guys can sing along if you would like. But it kind of captures the day and the father-daughter duo.
Does it ever end?
From the day we arrive as an intern. And blinking step onto the wards. There's more to see than can ever be seen.
You
more
can't
to
see it.
do than can ever be done.
It just can't be done.
There's far too much to take in here. More to find than can ever be found.
You gotta find it.
But the nurses are there through the long days and nights and give you perspective on life. It's
Thank
the
God for the nurses.
Circle of Psych.
Circle of Psych.
With its bumps and grinds.
Bumps and grinds.
Through despair and hope. Through faith and grit.
Especially grit.
Till we find our place.
Wherever that is.
On the path unwinding.
In the circle.
In the circle. The circle of Psych.
Perfect.
Thank you.
Thank you.
Good thing Mari takes after her mother.
Thank God.
That's great. Let's take a minute or two for any comments anyone has, thoughts, questions.
My honorary psych residency since 1974 at the age of 24, second-year medical student, 15 years. I won't say misdiagnosis, I'll say missed diagnosis, till I went to resign my position here at UCSD on July 6, 1989, 30 years ago. Fortunately, Dr. Galtz called Lou Judd, and within a week I was in Leighton Huey's office on July 13th, 1989, but who's counting? Suffice it to say, I quit ill-advised psychoanalysis on April 6, 1989, 30 years ago today. I exited Dr. Huey's 5 West psych ward on April 6, 29 years ago today, after a well-needed admission for rapid cycling bipolar disorder after being on 80 milligrams of Prozac that brought me out of a 5-year depression brought on by 15 years of misdiagnosis. So I've known Sid, Igor, Leighton, Dr. Schuchter, Dr. Perry, many other views through 30 years of now avid and rapid mental health advocacy. So as the non-psychiatrist who earned my training in the trenches, in the wards, and my new t-shirt will be, I survived 20 years on the faculty at UCSD. I just want to commend all of you. My first psych exposure was my father, who in the 1960s was on lithium treatment. I watched him go through ECT, alcoholism, and I told every one of 12 psychiatrists and psychologists from 1974 till I went in to resign at 1989 that my father had manic depression. Because I appeared so high functioning, not one considered that in the diagnosis. So if life gives you lemons, make lemonade. I've changed it to, if life gives you lemons, make lemon meringue pie. My 30 years of mental health advocacy, I've made a lot of lemon meringue pie with the likes of Sid Zizik and the rest of you. So I'm standing today. I didn't commit suicide, thanks to many of you. And thank you all for your 50 years of progressing us from the dark ages to what, as you said, hopefully the next 50 years. So I'm your poster child of the last 50 years.
Thank you,
Thanks
Connie.
to all of you.
Yeah. So, Connie, it's great to see you doing so well and,
Yeah.
and being here.
Just
4 months and 2 days, but who's counting?
just to let people know, though, Professor Nagy was the head of the dermatology department, or at that time it was division, I guess, within the Department of Medicine. Has been kind enough to be part of our medical student courses and to share her experiences with upcoming physicians. We're very grateful to you for doing that. I'm personally grateful to you for excavating my face several times with beautiful Mohs procedures. Maybe that's a hip of, well, I'm talking about myself, that's okay. So, and
I was the psychiatry dermatologist.
yeah,
Yeah.
I think Dr. Shuckett and many others of us have had the pleasure of meeting you in a different circumstance. Thank you.
Yeah, I was going to comment on that too. Thank you. So I hope everyone has learned as much today as I have. It's interesting. I often think of myself as kind of a critic, and I'm always kind of a naysayer and looking at what could be fixed. And when you do that on a day-to-day basis, you lose sight of all that's really good and really happening and terrific. And we have so much to be proud of. And I these were 3 terrific days. And I think all of us, probably even including Igor, but certainly myself, learned a lot and have a new sense of pride about what we're doing and a new sense of hope about the future. And breaking through some of this other crud that some of us have been talking about. And maybe we should be the leaders in the nation in terms of doing the research that will develop better well-being and wellness amongst the providers. Yeah, Dave?
I just wanted to, because I didn't say it before, I mean, this meeting totally blew my mind. What happened, when I left here, it was in 1986, and I came back in 2011, but I was down at the Gifford Clinic and sort of sequestered away there. I knew some stuff was going on. But this is absolutely amazing, because when we started, or when I arrived, let's say, I doubt there was 15 faculty members, maybe 20, and some of them, a few psychologists and more psychiatrists, and it kind of, and the residency was just a few people, and it grew, it grew a lot. So, I was just amazed and really thrilled at seeing the science of it, and the clinical stuff that's gone on. It's just amazing. And it is a little bit like feeling like Rip Van Winkle, and you wake up and, my God, what happened? So
Yeah.
I wanted to say that.
And so just before we end, I thank Igor not only for encouraging us to have these 3 days and today, and allowing me to have a role in this last day, but especially for your brilliant leadership over these past 5 years. And I think we all thank you for that, and we want to give you the last words today. So.
Thank you, Sid. I've already been the interrupter and disruptor in chief at these meetings, always poking my nose into it. Hey, but what I'd like to say, though, is just to recapitulate some things people have said already. These 3 days have been just a wonderful revelation, really, of everything that's going on in the department. In fact, Greg and I were talking earlier. I think now that I know something about the department, I may reapply because now I can really figure it out. Don't worry. But today, we've had just this wonderful exposition, really, of the clinical and the training programs. And just a couple of data points we've had today: 5 speakers, 4 panels, 8 discussants, 31 panelists for 44 presenters. And in the past 2 days before that, we had another 54, I think, people involved in different aspects of the science. So almost 100 people have participated in various ways, not counting the audience that has been interacting with us. So it's just a wonderful coming together of the department that I hope people have enjoyed. We've heard today about just 15 of our more than 20 different clinical services. And we've heard, I think, from 14 of our 28 training programs. So, we could have spent a lot more time reviewing this. And they range from this incredible, in an incredible way, from a medical student training, and actually we even have pre-medical school training as well, all the way through to the international programs in addictions that Igor Kutsnak was describing. I'm also very thankful that a couple of our distinguished alums from the 70s, Ken Corey and Davis Susskind, agreed to participate in this. Brian Bruns, you've hung in with us as well. It's really wonderful to see you guys here. So I do want to thank particularly Sid for organizing this particular event. I know you've had probably a panel of people that have helped you, but thank you very much for doing this. And of course, I want to again give a shout out to Felicia Roston, Carla Engel, Sean Ryback, our IT guru who's been here for doing this. And I do want to reassure Dave Janowsky that there is nothing new under the sun. We're back to marijuana. It's a very important area of research now. Before it was just an anecdotal thing, but now, now it's come. Dave will remember, or maybe he won't remember because it depends whether you've used the product, but I was involved in a study that Dave was doing on driving, airplane simulations. Do you remember?
You were in the study of the psychotherapy study, I think.
I thought I was flying a plane, maybe, but anyway.
You were flying high, Igor.
But what I do remember is that I think I got the active treatment because I went to the bank to try to sign a mortgage payment, and I said to Joanne, my wife, these numbers don't add up. And she says, yeah, they're fine. I said, no, these numbers don't add up. Anyway, that's too much disclosure, but that was part of a research program.
Yes, it was.
Okay, thank you all very much. It's a wonderful, wonderful event.